You clearly don't like death, and that's fine. But in what situations are you actually hoping that a patient dies?
I don't think I would ever hope that a patient would die, but I do recognize that sometimes a certain patient would come in at,
In
late
their
in their
KKK
years.
robes, and it's like, maybe we'd be better off.
No, that's not what I was going to say. But
Oh.
I would say maybe
so
a
you
very...
are cheering on the people who come in their KKK robes, and you're like, let's do our best to keep them here.
I've never taken care of a patient in a KKK robe, but I will say that some patients come in and maybe they have certain gang tattoos on them or other things, but we try again to not really focus on that and still provide high quality medical care to any patient that comes in.
Okay, great. So people are always writing in and asking, like sending me DMs, sending me letters in the mail, asking me, I'm worried I should go to the ER, how do I know? And I never know what to say.
So they ask you that?
Yeah. They're like, should I go? And I'm like, what do I say? I don't
And what's the nature of your media channel? Or
I'm just really I'm famous, and so people look up to me because they're like, I want to see what Caroline would do.
So they ask you for medical advice?
Yeah.
Okay, so what was the question, sorry?
If someone is worried, like, should I go to the ER? Am I fine? What's a sign like you should go?
I guess I'd probably start with what we call the ABCs. So
what if they don't speak English? It's feeling very Trumpian. Like, you must speak English right now. Say your ABCs or you're out. Like,
Yeah. I mean, I guess...
Would you accept the ABCs in Spanish?
Yeah. Again, the ABCs stand for different things. It's not actually, you're not actually having them say the alphabet.
Oh.
But yeah, like the...
What does it stand for?
So airway, breathing,
Oh,
circulation. If we even get farther, we can go like D for disability, which means is someone confused? Are they making sense?
Recently, I saw someone trip on the street, and I went up to them and offered them disability services because I was just trying to be nice, and they didn't want help.
So what does that mean by disability services? I'm not familiar with that term.
I connected them to a hotline that they could call because I actually have no idea how to help anyone with a disability. But they didn't want my help.
You gave them a phone number.
Yeah, they didn't want my help. They didn't want to be saved. How do you force yourself on someone who says, no, 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 no?
Well, typically people aren't coming into the ER and saying, no, 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 no.
Okay. But what if you found someone on the street who needed help and they were like rejecting it? Would you force yourself on them?
I mean, paint the scenario for me. How
Someone
badly
gets
injured
hit
are they?
by a bus, like their legs are like cut off from the knees down. But they're like,
But they
this
seem
is
to be
what
refusing
God wants
help?
for me. Leave me alone.
Well, I mean, that's a complicated medical ethical question, but I think you have to kind of consider whether or not there's a head injury playing a role or they're intoxicated. So, you kind of have to make the judgment on whether or not, that you can potentially intervene and save this person's life. And maybe they're not making the right decision at this time because they lack capacity is what the word we'd actually use.
Okay.
So some people lack capacity. We sometimes deal with people that are crazy or intoxicated or in a psychiatric psychosis, and we still have to administer care even though they might not be happy for that care right now at that time.
Yeah. That's similar to what my friend James said. There was a girl at a party in college and she was incapacitated, but he thought he knew what was best for her. It's a long story, but as a doctor, how often are you judging a patient?
I mean, I try to resist any desire to judge a patient,
Well, I only ask because my cousin's step-uncle he's this real like rotund kind of guy. He's got a beautiful body, okay, he does. But we talk about like an hourglass figure, a pear shape. He's like Salvador Dali painted him. Have you seen The Elephants by Salvador Dali?
I think I know which painting you're talking about.
That's his body. Okay. So he's nervous to go get the medical care he needs because he knows he's going to be judged. What advice do you have for him?
I think if he needs medical care, he should still come in regardless of his
shape.
Yeah, his shape or his, self-esteem. Yeah, if he needs medical care, the ER is available for all people to come in.
So I guess it's safe to say Dr. Jeddick thinks that, people of all shapes and sizes should get health care. Fat people, skinny people, really tall people, it doesn't matter, you think, no matter what you look like.
Well, we try to stay away from like that inflammatory, like insulting language. Like we would say someone's overnourished or appropriately nourished or undernourished. That's the term.
But that's like fat phobic. Like who cares? Fat's not bad. It's not bad to say you're fat unless you say like you're a fucking. What type of patient is the worst to treat?
I don't know. I don't think that there's a type of patient that's worse to treat.
Not Jehovah's Witnesses. They're so picky. It's like.
Well, I mean, the complexity with Jehovah's Witnesses, you just have to know that they don't accept blood transfusions. So I don't think that makes them the worst to treat, but that is something you need to consider when you're providing medical care.
Okay. Mm-hmm. What is a moment that you're the most proud of in your career?
You know, almost every week in the ER, you're in a case where someone comes in cardiac arrest and, you know, meaning their heart's not beating, we're doing CPR, and you're actually running the code and provide the right care to save their life and get them into the ICU. That's a pretty fulfilling moment, and I've had many, many of those in my life.
So your proudest moment is hovering over the body of a severely injured individual. Have you ever seen Nosferatu?
No, I've never seen that. I don't know what that is.
Don't worry. It's kind of a documentary type. Well, it's just kind of related to your work.
Okay.
It's just, you can see why people think doctors have egos. Because personally, like, my best moment of my life would have nothing to do with people near death. Mm-hmm. I actually think dying people are like the worst type of people.
Well, I think the worst situation would be a scenario where you don't save that person, which happens, unfortunately, sometimes.
Well, that's true.
Yeah.
So you're like the second worst scenario. So that is better than what I thought. So that's pretty good. I just feel like it's like if I visited my grandma on her deathbed and was beer bonging over her trembling body. Would you say that's inappropriate? Can we agree that that would be inappropriate?
That would be very inappropriate, I agree.
Yeah. Okay. Mm-hmm. Great. Perfect.
But I'm not sure what that has to do with my...
Speaking of doctors having ego issues, are you actually better than everyone else, or do you just think that you are?
I don't think I would answer that question with either of those responses, but...
What do you think then?
Yeah, no, I don't think I'm better than anyone else in particular. I mean, I think everybody chooses their own profession and their own career for whatever reason they do, and I chose medicine actually because I wanted to help people.
Okay.
But
so you're no better than the racist next door, you know? You just said you're not better than anybody, so I just think it's important to be precise with our language.
Okay. I'm not sure if that one fully makes sense, but...
What's like one of the worst family member interactions you've had?
I mean, I've seen incidences where the family members become angry at the medical team.
Yeah.
They don't understand what the rationale is for the procedure or
right.
what's going on.
They're
Especially
like, you're putting your hands all over our daughter, don't touch her, kind of a thing. Nothing inappropriate. There's no inappropriate touching, but there would be like actual medical procedure going on that the family would be unhappy with. It just seemed like you were implying something there that it's interesting you took it to inappropriate because I wasn't thinking anything inappropriate. So the fact you jumped there is...
Okay, just making sure that we're on the same page there.
That's great. Mm-hmm. Okay, great. So if you have to tell someone, a family member, bad news, how do you typically say it? Because I'll run by you like my idea and you can give me feedback on that.
Okay, let's do that.
Something that has been really effective in my life is I'll tell someone something way worse and then you say, I'm just kidding, it's this. And it's like, now that thing doesn't seem bad at all.
So you're going to tell them one thing that's really bad and then say just kidding and tell them something else?
Exactly. So here's what I would say. I'd say, hey, so in the last hour, 130 people around the world have been sold into slavery. Okay. Keep that in mind when I tell you that your mom is not one of them. But she did pass away, unfortunately. But at least she's not a slave. So, I guess. So, that was my idea.
Okay. I think I maybe understand the psychology that you're trying to get. I don't think that would work very well in the ER. And I don't think it would be received very well to use that particular strategy.
Okay, that's fair.
Yeah.
What would your approach be?
We have what's called a quiet room in an ER. So we just try to remove them from the setting and the chaos of the ER. My approach is to first introduce myself so I know everyone by name and I can address everybody appropriately, understand what their relationship is to the patient that I'm going to give the bad news about. I think it's important to be just very honest and let them know what happened. Be very sympathetic and empathetic and understanding in terms of, the gravity of the situation. Sometimes that might require kind of reading the room and seeing how different people are reacting to see how you want to approach that and which direction you need to go in.
Because I think that would not work for me.
Yeah.
I feel like your vibe is really depressing. It's really serious. Like, I just don't respond well to that. So I would appreciate more of like the air horn moment or something to kind of lighten, to make it feel like everything's going to be okay.
Yeah, I'm not sure how to use the air horn, but I do agree that sometimes some people even appreciate humor in the times of tragedy.
That's really nice.
So that's my approach.
That kind of changed my mind about you so far. You're doing a little bit better now.
Okay.
If you had to have an STD, which one would you pick?
I don't think I'd pick any of the STDs.
Which is the best though?
Which is the best STD?
Yeah.
You mean which STD is easiest to treat? Is that?
However you would define best.
Yeah, I don't really like the nature of that question to say which STD is the best. I think that's could be offensive to answer it that way. You know?
Okay, I see.
But if you wanted to rephrase your question, which STD is the easiest to treat?
Sure.
I'd feel comfortable answering that question.
Okay, which one's the easiest to treat?
Probably any of the bacterial ones, like gonorrhea, chlamydia, syphilis.
Okay.
They all have obvious antibiotics to treat it with. So.
Are you okay if I titled this video, ER doc, super excited about gonorrhea, chlamydia, or just something just for the clickbait aspect?
No, I would prefer you didn't name the video that.
All right.
Yeah, I think that wouldn't definitely take my comments out of context.
Okay. As a doctor, we'll just say, what's one of your more controversial or unpopular opinions? Like something like gonorrhea is not that bad.
I think maybe more of my thoughts on just kind of our healthcare system.
That you love it?
No, I think our healthcare system is really broken. I think there's a lot of challenges that are put on the physicians. I think the whole economics of healthcare are really tricky. The fact that specifically in the longevity space, a lot of the private health insurance companies are only around to pay for medical conditions until they can kind of kick the can to the next person. And then once the patient gets old enough to accept Medicare, then they become the government's problem. So the healthcare system and the insurance companies are not incentivized to actually try to prevent those chronic conditions.
That's rough. Well, that takes us to our next section, I guess, about longevity. You opened a clinic based on the idea of living better longer. For people who don't know what that means. It's not about lengthening your penis. It's not about anything crazy. Just like calm down. But what do you say to all the people who accuse you of being the Walmart Brian Johnson?
I don't think anybody's accused me of that, but...
do you know who that is?
Yeah, I know who Brian Johnson is.
Okay.
Yeah.
I would say, are
longevity.
you the Temu Brian Johnson, but I'm not trying to imply that you're Chinese or something. Because maybe you are Chinese or maybe you're not, I don't know. But anyway, what do you say to all the people who say that to you, though?
Well, I've never had anybody say that to me. Let's just clarify there, okay? Nobody's ever said that to me. Yeah, you'd be the first. But I think there are similarities in terms of what our mission is and what Brian Johnson's trying to achieve.
Yeah. How many total years of your life were you in school for, from kindergarten on?
Okay, so let's see. High school is 12 grades, and then 4 years of undergrad, 5 years of med school. If we count residency, that's another 4 years.
Because I was in school for literally a third of that. So I don't want to compare anything, but you might have needed a lot more help than me or something. It's hard to say, but okay. What are the 3 worst looking things you've ever seen walk into the ER? And I'm talking about medical cases, not the ugliest looking people who have come in. And I'm talking about what's the opposite of chronic? People coming in with a specific, what's that?
We say acute.
No. I'm not talking about cute, ugly. It doesn't matter what someone looks like. It's just, I feel like everything's so image oriented for you. It's
No, the opposite of chronic would be an acute medical condition, like something that just happens suddenly right before they came in, versus a chronic condition, which is something that develops over time. That's what I was kind of trying to refer to. Just
answer the question. That's fine. What's the craziest thing you've seen in the ER?
The craziest thing?
Yeah.
Sometimes we see people that get stuff accidentally stuck up their butts. That's kind of crazy.
What's the worst type of injury to get, regardless of whether you're attractive or ugly? Because obviously that one's more just for ugly people.
What's the worst kind of injury?
Yeah.
Is the question?
Yeah.
I don't know if there's a specific injury that's particularly worse than another. Facial trauma is really bad.
But see how every question you're bringing it back to how attractive someone is, how cute they are, what their face looks like. It's just everything is about the image. It's wow, okay. Just a note for you in your life, something to think about. Is it realistic to think that we might be able to stop or even reverse aging someday?
I think there's some people that think that that's possible.
Do you? What would have to happen?
I think that's still unknowable at this point.
What would have to happen medically? What would that look like? I would understand, but explain it like someone's in preschool. Not for me, but just because the audience.
Clearly, there's a biochemical process that's happening
that's too big of a word.
Considered aging, right? So we're having certain things happening at the cellular level. You have little cells, and you can actually look at them under a microscope and see the difference between a cell in any tissue of your body when you're young and when you're old. And so something is happening there that's making those changes. And if we could truly identify every step along the way, along that path, then I guess it's at least theoretical that someone could either delay or potentially reverse death. But I think we still don't know right now if that's possible. Okay. We could definitely delay death by just being healthier, which is what we try to do.
If someone stopped aging physically, would it be okay for a 300-year-old male to date a 17-year-old female?
Probably not. Because I mean, I think right now it probably wouldn't be appropriate even for a 70-year-old male.
It happened in Twilight. Happened in Vampire Diaries.
But that's like a vampire that hasn't aged, so they appear to be like a
300 years old dating a girl in high school who's like 16.
Yeah, that is a paradox.
It's not great. I just don't want to support that on camera. I don't know if you want to take a stand against it on camera or not, but...
I'll think about that when I get back to you.
Okay, interesting. On the topic of immortality, if you had a clone of yourself, would you want to have sex with it to see what you're putting everyone else through?
No, that's a weird question.
Okay.
I don't really know how else to answer that question.
That's a fine answer.
Yeah.
Okay, great. Well, so now we're going to do like a sample care thing. So I'm going to put on a patient gown and come back and we'll do a visit as if I'm a patient.
Okay. Are you still interviewing?
Kind of.
Okay.
We're doing a sample patient. So I am patient, what should my name be?
Chip.
Jehovah.
Okay.
Okay, my name is Jehovah, but I go by Chip. And I'm in a different outfit because I want you to, this is like the first time we've met, because I feel like we just got really comfortable with each other in the interview, and now you need to be uncomfortable again, so we can see how realistically you would act.
But you're not supposed to be the same person, like...
No, I'm someone else. I just said I'm Jehovah.
Okay.
Okay, so say someone is choking. What should you do?
Yeah, I mean, I think that's a great question, because that's a common thing that happens, and it could happen to anybody that's out in public at a restaurant or something. But I think it's first to recognize the kind of the universal gesture for choking, which would be this, if someone does that. And they're, obviously, if they're changing color and they're unable to breathe, they're coughing, they're unable to talk.
Okay.
What you would do is you'd get behind them and you'd use a mechanism called the Heimlich Maneuver. And a lot of people have already heard of that before.
Like a Hitler salute? No thanks.
No, it has nothing to do with Hitler.
What do you do? What do you actually do to someone?
So you would get behind them and you would take your fist and you'd put your hand over your fist and just below the sternum.
So you want me to go up to someone who's choking and assault them? It's like, it's just anti-Semitic.
Again, it has nothing to do with Germany during World War II. It's not related at all.
The Heinrich Himmler?
No, Dr. Heimlich invented this maneuver.
Am I dyslexic or is that the same thing? Okay.
This is something that's taught in pretty much any basic CPR class.
White supremacist culture?
You said you taught a first aid class, right?
Yeah.
Did you actually ever attend a first aid class?
No. I just guessed off of what I thought felt right.
Okay.
Do you have any questions for me?
Yeah, Chip. Since you said that you had taught that first aid class, I just have a couple questions to kind of just see if just assess you to see how much you actually understood in that class.
Perfect.
How would you go about treating an abrasion if you saw one?
Oh, that's fine. I have no problem with Asian people.
So how would you treat that skin injury then?
I don't think Asian people need to be better. I think that they're perfectly fine just as they are.
Oh, I think you're confusing the word I'm saying. I'm not saying Asian, I'm saying abrasion, which is an injury
Isn't that slang for a brave Asian?
No, it's like a scrape. Do you want to try a different injury?
Sure, yeah.
Okay, what would you do if someone twisted their ankle?
I mean, I'd probably tell them to walk it off. Like, unless you're going to be seeing bone or something, why?
On the injured ankle?
What am I going to do? I'm not a doctor. So. Okay, I'm ready.
Okay, so I'm going to make the universal choking symbol.
He's choking. How do you know if someone's really choking or if they just want you to come touch them from behind?
That would be a very difficult thing to tell, but I would think that it should be obvious based on their color change or some people
are really good actors, but yeah. Okay.
Yeah, that would be an unusual situation, I think, to be in, where someone's faking choking to get you to touch them.
This has happened to me.
Okay.
Okay,
kind of like that. Yeah, I think that would probably work.
Okay.
I think that would be effective.
How hard do you have to go?
I mean, in that situation when someone's actually choking, you're probably going to go pretty hard.
Okay.
Yeah.
Okay, you're going to go pretty hard.
Yeah.
Perfect. Okay, great.
That's what you teach in your first aid class?
Yeah, I mean, you don't want some random person on the street who like makes Instagram videos to help you. So I think promoting people like me, like helping with really serious injuries, is probably a bad idea.
Okay, so you don't want to go down this line of questioning?
There's certain injuries I could help with, but...
Okay, which injuries would you feel comfortable treating?
Internal, like people feeling like they're too ugly or something.
Oh, so more like psychological injuries? Or
Yeah, that's kind of my specialty.
Okay. Okay. What's your favorite mental health injury to treat?
Definitely schizophrenia. The last thing I have to ask you is just, do you have any feedback for me as far as how this interview went, or how my first aid training is going, or like just what are your thoughts about how this went today?
First of all, I didn't know you were training for any kind of position, and I don't think we have a position for you.
It's self-elected.
Here. Okay. But I thought the interview started off fairly well, but then I got a little confused by the nature of your questions, and I think that in some ways you kind of misled me in some of your questions. But
misled you?
Yeah, I felt like there were some kind of like traps you were trying to walk me into that made the interview feel a little uncomfortable and challenging.
Mm-hmm. You know, people say that whatever you're looking for in life, you'll find. So if you think people are out to get you, then that's on you. Just an example of how I'm really good at like mental health stuff. So, okay, great. Thank you so much. And this is Dr. Rocky Jeddick. And if you feel comfortable, like come to his clinic, or if you're a flight person, or what's it, a pilot? I
do some aviation medicine with pilots too. Aviation medicine with pilots, yeah.
Do you typically show people the movie G-Force?
I don't think I've heard of that movie.
Okay.
But I'll check it out.
Pretty much one of the best movies that's ever been made, but okay. Great, thank you so much.
Thank you. It was really fun.
Okay. Bye.